Mohammed Al-Mawri of Dearborn gets help Tuesday picking a health care plan from navigator Rawa Abu Rabi at Access in Dearborn. Photo, David Gerlnick / The Detroit News, by photo. Michigan enrollment is up at healthcare.gov as 115,595 consumers had signed up for health insurance through December 2, a nearly 25% increase over this time last year, according to the latest numbers from the U.S. Department of Health and Human Services. This year's open enrollment period lasts just 45 days, compared with 90 days a year ago, increasing the intensity for insurers and health advocates who help people sign up. Consumers have through Friday to sign up and select a plan. Honestly, our lines have been ringing off the hook and our schedules have been booked up through the end of open enrollment for about a week, said Farah Urzuki, Public Health Coordinator at Access in Dearborn, which provided enrollment assistance to 1,200 people in November alone, 100 more than during the same month last year. I will say that our offices have been busier than ever this open enrollment season. People are seeing these uncertainties, and people are seeing the shorter open enrollment period as even more reason to come through our doors and get covered. National enrollment topped 3.6 million by December 5, the end of the fifth week of this year's open enrollment period. That's up from last year, when 2.9 million had enrolled by the end of the fifth week. But by the end of last year's 14-week open enrollment period, enrollment had grown to more than 9 million. In Michigan, 321,451 signed up. Updated numbers are expected to be released Wednesday morning. I'm not sure where those numbers are going to end up, but I think overall it's a success story, said Lori Lodes, co-founder of Get America Covered, a Washington, D.C., based national nonprofit that helps people with the registration process. Demand for coverage is so incredibly high, that's what we're seeing. There are more people getting coverage than ever before, and that speaks to people valuing having health coverage. Health advocacy groups, such as Access, have fewer navigators to help people sign up in the wake of cuts in federal funding. Federal marketing and public education efforts also were slashed, so less information has been available about how to enroll, advocates have said. The U.S. Department of Health and Human Services announced the shortened enrollment period early this year as a way to better align with other federal programs, like Medicare. The change was also promoted as a way to keep consumers from gaming the system by waiting until they are sick to enroll. But critics charged the move was intended to undermine the health insurance exchange, which is a cornerstone of the Affordable Care Act. One Dearborn resident, Mohammed Al-Mawri, was at the Access offices on Tuesday seeking information about his health care options. The 43-year-old is a refugee of war-torn Yemen, who came to this area last year with his wife, Saba, 32, and their 3 small children. Saba Al-Mawri, an American citizen, and her children qualify for Medicaid, the federally funded health insurance program for low-income people.